This is a great expert that we are very proud to have on stage with us. This is Dr. Rudy Mueller, and he is the Longevity Clinical Director here with Longevity. He has studied with Dr. Jones through multiple longevity masterminds. He has helped train tens of thousands of doctors. He has been a keynote speaker around the world at conferences with people like David Asprey, Sandy Kaufman, and many others. He's also built his own custom longevity protocols, programs, and systems for his patients, and has created outstanding clinical outcomes doing so. He's known for being one of the best doctors to reverse the biological clock within the body, and he's able to understand the science and business elements of running a successful longevity practice. So not only does he get the nuts and bolts of operating on the human body, but also of the cash register. So this is a very smart guy who understands. And in fact, he's been able to use Health Expert Alliance to run his burgeoning practice, exploding practice in Maine from Miami with his wife, where he lives. He can run it remotely because he's using these systems so accurately and so well. Dr. Rudy is has mastered the world of peptides, bioregulators, cellular detoxification, advanced regenerative medical solutions. You don't have to ask me. You can ask all the top NBA, NFL, Major League Baseball players. If someone is important and their body is paid to use it, this guy has probably talked to them. So, ladies and gentlemen, do me a favor, put your hands together for Dr. Rudy Mueller.
Thank you. I appreciate it. Well, it's a pleasure to close out. Obviously, I am not Dr. Chen. Unfortunately, he ran into some problems with that hurricane. So I came from Fort Lauderdale, Florida, was able to escape just in time. Unfortunately, he had some problems with his family. I think his mother's house ended up with 4 feet of water in it from this hurricane. So please have your prayers and thoughts with him. This has been an excellent event. It's a pleasure to get up on stage and speak to you today. And we're going to be focusing in on unlocking longevity and healthy aging. So in this talk, we'll be talking a little bit about epigenetics, the hallmarks of aging, the metrics of aging, epigenetic mechanisms on aging, the DNA methylation, the clocks, biological clocks versus your chronological age, holistic longevity method, and then age reversal intervention pathways. So epigenetics, right? We all probably are familiar with it. If you aren't familiar with it, these slides are for you. So epigenetics means above the genetic code. Epigenetic changes can really lead to varied gene expression whereby genes are either silenced, turned down or turned off, or reactivated, turned up or turned on. So these modifications play a role in the formation and progression of age-related diseases or health and cellular longevity. These changes are reversible and potentiated by diet, lifestyle, environment, stress, sleep, as we just heard. The epigenome, it consists of the chemical compounds and proteins that attach to DNA, signaling genes to turn on or off. And one of the cool things about the epigenome is that it's transgenerational. So when you're looking at patients and you're talking to them, looking at their family history, one of the most important things that I can recommend that you do is look at their mother's health and their father's health at the time of conception, and then the birth history, and then prenatal care throughout the pregnancy, and then the birth process. So hallmarks of aging, right? We started out with 9 hallmarks of aging about 10 years ago. Now in 2022, about 2 years ago, we expanded on the hallmarks of aging. And there's 3 criteria for the hallmark to be a hallmark. Number 1 is must manifest in normal aging. We must see it in the normal aging process. Number 2, if we lean on it, if we push on that pathway, does it contribute to accelerated aging? And number 3, can we improve longevity by ameliorating it or by addressing that particular hallmark? So here's another image of the hallmarks divided into the 3 different categories. So we have the systemic level, we have nutritional dysregulation. At the cellular level, cellular senescence, stem cell exhaustion, and altered intracellular communication. And then at the molecular level, genomic instability, telomere shortening, loss of proteostasis, compromised autophagy, and mitochondrial dysfunction. And the one that we're going to be focusing in on a little bit deeper today is the epigenetic alterations. So when we look at epigenetic alterations at that molecular level, epigenetic refers to these chemical changes that, as I mentioned earlier, switch genes on and off. When I talk to patients, I often refer to it as a dimmer switch. We're either turning up or turning down this expression. And the key epigenetic mechanisms that are causing or creating this change in the epigenetics is DNA methylation, histone modifications, non-coding RNAs. Loss of the accurate epigenetic regulation disturbs the cellular identity and function, and erosion of this really brings about the rising chaos that underlies aging. So which hallmarks of aging relate to epigenetic aging? So this is an interesting study performed by Dr. Raj, where he looked at all the different hallmarks, and he said, is it consistent, or does it communicate or tie over to the epigenetic age? And so what we found is that deregulated nutrient sensing, mitochondrial dysfunction, stem cell exhaustion, and altered cell-to-cell communication are all impacted by this epigenetic alteration. So really we had a big shift, right? Originally, the previous dominant theory was that aging is a result of cumulative DNA damage and mutations. Emerging perspective is that aging has a significant epigenetic component. It's how our DNA is expressed, not just how it's altered. And genes are regulated by turning on and off and influenced by the environmental and cellular factors. So how many of you, by a show of hands, I can't really see too well up here, but by a show of hands, are integrating longevity into your current practice? How many of you have an interest in adding longevity to your clinical practice? Good, good, I'm glad to see that. You're in the right place around a lot of great minds and great people. So with the role of DNA breakage and repair in aging, we have the DNA damage. Okay, this is naturally occurring. It's happening right now. Millions of times per minute, our DNA is breaking, and our body is trying to repair those breaks. There's an impact on the chromatin structure, which you can see in that image, where the histone wrap and the chromatin. We repair the processes through utilizing proteins that alter the chromatin and affect the gene expression. So what happens is we have these damaged DNA like breaks or particles that occur, and it's caused by our environment, our lifestyle, our stress, our poor sleep, our overexercise or lack thereof, chemicals, microbes can all impact the DNA. These little fractures occur, and the chromatin and the loosening and tightening of these areas, we loosen up so proteins can flood into the area and repair those breaks. The proteins then fly out of that area. The chromatin is supposed to tighten back up, and then we would have normal repair and function. Now, over time, we can have dysregulated gene expression if we have repeated breaks that disrupt this normal chromatin resetting, leading to cellular dysfunction. And so when we saw this out of Harvard, there's a twin mice experiment where they used transgenic mice, and they turned up in one of those twin mice an enzyme that caused more DNA breakage and fractured. And what we can see here is that this mice and these two mice right here are twins. They're the same age, but we can see that we have accelerated DNA breakage results in visible aging despite the identical DNA sequencing. So it wasn't that they were born with bad DNA, it's that the DNA damage, the epigenetic expression of the DNA breakage has resulted in this mouse aging at a more rapid fashion. So conclusions, right? So we talked about the 3 criteria for something to be a hallmark. This identified this epigenetic changes as being a hallmark. Aging is linked to the epigenetic changes, not just the DNA mutations. So chromatin and its cellular function. We have different dynamics amongst the chromatin, right, which I mentioned earlier. It must loosen and tighten to allow access to relevant genes as we're coding, as we're repairing. The breaking in these DNA chains allow chromatin to open up and loosen. Sometimes it loosens for too long or it loosens incorrectly, and it results in inappropriate gene expression, accelerating the aging process. DNA repair is the proteins involved, right? As I mentioned earlier, they come in and they help repair the DNA, and then over time, they can become fatigued, they can become jumbled, and they're not able to do their job as efficiently as before, which then can lead to premature aging. Now, one of the other criteria, if we go in and address this hallmark of aging, can we see a reversal? So resetting the epigenetic structures in this, out of Harvard again, the experiments show that we can successfully reverse blindness and rejuvenate kidneys and muscle tissue after it's been turned on to age. And so we may be able to, through different types of strategies, be able to reverse this and change the instructions or reset the instructions for the cells to repair, regenerate. So we can see here is that the epigenetic program is rewired over the lifespan, leading some to hypothesize that the epigenetic change may be the root source, the root cause of age-related phenotypes, so the expression of the epigenetics. So really, when I asked to come up here last minute and be able to present to you, I really want you to be able to have a lot of takeaways. I don't know about you, but I've been listening to these speakers. It's been wonderful, taking a ton of notes. Do you have takeaways that you're going to be able to implement on Monday? Yes? Good. So when you're thinking about the hallmarks of aging, when you're thinking about longevity, I want this last part of the presentation to really resonate with you and really know where you can go with testing, what types of pathways I'm thinking about when I have a patient that I'm trying to transition or promote longevity for. And so when we're focused on the metrics of aging, which we'll get to on the next slide, we have three different areas. We have the biological, so the cellular level, the molecular level. We have the phenotypic expression, and we have the functional level. What types of symptoms or signs or diagnoses is this person experiencing? So you're going to utilize your assessments. You're going to utilize the testing. A lot of the testing that Vibrant offers is phenomenal to figure out the biological, the phenotypic, and then some of the panels to help with the functional aspect of it. Potential therapies, explore different compounds or lifestyle interventions that promote effective DNA repair and prevent that chromatin misregulation. Think about some of the things that Dr. Gladden talked about, Dr. Hyman talked about with the urolithin A, the postbiotic. Potential for epigenetic reprogramming as a tool for reversing the age-related tissue dysfunction and therefore reversing biological age. So here's this is the metrics of aging. So you have the functional aging, the phenotypic aging, and the biological aging. So starting at the bottom, this is at the molecular level. So one of the primary go-to tests that Vibrant offers is the oxidative stress panel, and it gives you a biological age of comparing where your oxidative stress is compared to somebody who's potentially older than you. And so we can figure out a biological age around the oxidative stress. For phenotypic aging, we're really looking at the phenotype, the presentation of that individual in front of you, that's sitting in front of you. So body composition, we utilize DEXA scans or body composition BIA machines, right? Energetics, looking at the mitochondria, nutrition regulation, macronutrient regulation, homeostatic mechanisms, brain health as well. And so one of the tests that they offer here at Vibrant is a post-translational testing where we're looking at amyloid beta, phosphorylated tau, oxidation of ApoB, it should say 100, and really tying that over to somebody who maybe has cardiovascular risk, Alzheimer's risk, having early signs of cognitive decline, and then getting up into that functional level when somebody has decreased cognitive function or they have a family history of Alzheimer's or dementia, looking at the different influencers that can impact the brain, whether that be the metabolic panel that Vibrant offers paired with the amyloid beta, the tau protein, a functional neural panel for brain health and disease risk. So you have a lot of options in your armamentarium of Vibrant testing to be able to address these different areas for individuals. So the oxidative stress panel, I want to focus in a little bit there. Your ability to handle oxidative stress can be picked up from this oxidative damage score. And you can see over here on the viewing left, the free radicals and the different enzymes that we're looking at in the test. Oxidative damage score, you can see that ideally you want to be below your chronological age to get a good oxidative damage score, but it can start to trend up, and that can be a real eye-opening test or lab to put in front of your patient. So I utilize these different tests to not only glean results, but try to figure out, is this test necessary to create action, create and motivate this patient to make changes? So another view of that test, with the oxidative panel. You know, in the yellow for this result, given age is 55. You want to be below that line on the bottom right-hand side. Get into that green area, and your oxidative stress for this individual is 66.02 years. So they have, 11-year difference between their chronological age and their oxidative age. So a number of studies have looked at these different methylation areas throughout human lifetime and show that it exhibits strong correlations with age and age-related outcomes. So the particular areas that they're looking at are the CPG sites. And so CPG sites are where a cytosine is paired with a guanine with a phosphate group. They're linked together. And so when we look at these biological clocks, Grimm age or phenotype age, they're examining these different CPG sites to look at the methylation process. These CPG sites can be impacted and over-methylated when DNA methyltransferases gets turned on. It can attach that methylation group to that area, and it can show that we have a higher biological age because of this impact. Ruh-roh. There we go. So CPG methylation epigenetic adaptation. So what we're talking about here, right, is what everybody's working with. It's the environmental factors, it's the nutrition, it's the toxins, it's the lifestyle factors. All can modify that CPG methylation site. And long-term impact of over-methylation of these areas results in poor expression of the genes and poor health outcomes. So here's a few studies on the epigenetic clocks and DNA methylation. Is anybody utilizing epigenetic clocks in their practice? Not too many? All right. So epigenetic clocks use these algorithms to calculate biological age on the basis of a readout of the extent to which thousands, some test tens of thousands, hundreds of thousands of areas looking at these CPG sites to look for the methyl groups. And then they can form a good opinion of what your biological age is. So when we look at this graph here, the blue line represents your chronological age. Where do you want to be? Do you want to be in the, pastel color, or do you want to be down in the green? Good answer. The green, right? The green. And so when we look at the way that these biological clocks have been developed, we had first-generation clocks. So you had the Horvath clock, or the original clock, the Horvath age clock, the Hannum clock, and then a variety of lesser-known ones. And we've filtered through those. We've moved on to the second-generation clocks. And I anticipate this will continue to go and get better as we increase and improve our research. But with the second-generation clocks, one of the most predictive is the Grimm age and the pheno age. And it was designed to reduce the statistical noise and measure biological age and lifespan. So a feature of these clocks, the epigenetic age acceleration, which is called remember the turtle in the hair? The Dunedin Pace score is one of the most valuable scores that you can get from these tests. And so this is just an example of the CPG islands that are being examined. When they're unmethylated, we have good gene expression. When they are over-methylated, we can turn certain genes off. And so obviously there's a balance, right? We're either turning on good genes, potentially we're turning on disease genes, we're maybe turning off disease-promoting genes. So there's a balance throughout this entire process. But when we get to the biological age testing, here are some of the most valuable markers that we've found to use in clinical practice. So number one, we have the omic age, right? So this is that one number, and I totally agree with Dr. Gladden, who was he spoke yesterday, I believe, about this, right? There's not just one age, right? We're as old as our oldest biological age, whether we're talking about the kidneys, the liver, the lungs, the brain. But what I will say is that I've found this number to be extremely beneficial in the motivation of clients and moving them along. So we have a functional medicine practice in the state of Maine that COVID pushed us down to Florida. We were able to maintain our brick and mortar that integrates IV vitamins and peptides, IV ozone, saunas, and then be able to transition everything to virtual with the help of Dr. Jones and the Health Experts Alliance and have a successful practice. what I will say is that majority of the people that are coming into me, we're treating with functional medicine first. This is not the primary test that we're going with. We're leaning on the Vibrant labs, right, to identify the potential causes and root issues. We're working with their lifestyle and changing their diet, putting them on a nutrition plan that is customized, a little bit based on genetics, but more about what their phenotypical expression is. As an example, a SIBO patient, we're going with a specific carbohydrate diet or a FODMAPs diet. And then as we move them away from the symptoms and the diagnosis and the difficulties that they're having, then we're trying to figure out what the next thing is and the next thing, right? I mean, how many of you have all patients that are coming in that are as healthy as can be and are really interested in longevity? Yeah? Great, that's awesome. There's a few of you out there. I think that that is a beautiful spot and a sweet spot to be because they want to take action and they're ready to go. I will tell you that the majority of the patients that we're introducing the longevity information to and biological age test are those that have come along, they've been with us for a year, maybe 2 years, working through some of these challenges that they've had, and now they're like, well, what's next? And so if you work with programs, if you have like a 3-month program or a 6-month program, I highly recommend you start learning more about longevity. Take a look at your own biological age and see what that is and start to play around with some of the things that we're going to talk about here in a few minutes. That will help you figure out where longevity fits into your practice. And for us, it's that. We probably have maybe 1 in 15 to 1 in 20 people are extremely healthy and looking to come in for longevity. So what I like about this panel here is that you get the pace of aging, you get the telomere length as well, and then you get the symphony age. And so this is a nice little average around different systems in the body and give you a biological age of that organ system. And then with all of the difficulties around COVID and the vaccinations, et cetera, we can see immune health and the age of different immune cells as well. So this is a very rudimentary slide, but I want you just to start thinking about longevity in this way. Be thinking about what lifestyle interventions are you recommending. We've heard some great ones, right? We've heard about time-restricted eating or intermittent fasting. We've heard about nutrition with Dr. Rhonda Patrick and supplementing with vitamin D and magnesium. Good foundational things to be considering. And then pharmacological intervention. This could be supplements and nutrients. It could also be the pharmaceuticals. If you are not familiar with things like Senolytics, I would look into Senolytics. So we've heard of zombie cells or senescent cells, the cells that won't die that we want to kill. Well, there's some really cool things that we can do from a natural side and then be a little bit more aggressive with things like the satinib. Quercetin is a great one to go with. And we have the xenomorphics. So you've heard about resveratrol. I'm along the same line as what we've heard with metformin, not my necessarily go-to, but thinking about that AMPK pathway, the mTOR pathway. Do I want to promote growth in this individual? Do I want them consuming more protein, putting on muscle mass? Or do I need them to be losing weight? Just meet the patient where they are. Anti-inflammatory drugs or nutrients are extremely beneficial to, more the nutrients, to the microbiome, to the brain, overall through the entire body. Antioxidants, curcumin and ginkgo and flavonoids. I think Deanna Minnick is the big proponent of eat the rainbow, right? When I teach in Japan, we talk to all of these Japanese doctors and health coaches, eat the rainbow. And they do such a great job of adding in fermented foods, but they've been Americanized a little bit too. So I think that's one of the most simple things to be recommending if anybody's trying to get into longevity is eating the rainbow, eating a bunch of different vegetables and fruits, not Skittles, not Starburst, right? But eat the rainbow so that you can get the phytonutrients, you can have the impact on the microbiome that you're looking for, hopefully producing more urolithin A, that postbiotic that was mentioned earlier. And then others around nutrients. All of these things, and then some, can be very impactful for reversing that biological age. And so with the biological age test, we're often running it, when we're ready to talk about longevity, and then after implementing some of the strategies that you just saw and some additional things like peptides or peptide bioregulators or hormone replacement therapy for some. We remeasure it about 6 months and 12 months out to see what kind of trends we're having. So here's some specific interventions that I would recommend around this particular hallmark of aging, the epigenetic alterations. So we've already, you've talked about sleep, you know about stress resilience, you know about nutrition, but here are some additional nutrients that have been effective in changing the epigenetic alteration. So we have the sirtuin activity with nicotinamide riboside, or NMN. Research is on this right now, but there's still some promising results. Curcumin, green tea catechins, resveratrol, spermidine, and then testing. Testing in this area is huge. And so with that, Vibrant offers the NutriPro panel. Has anybody ordered that here? If you haven't, you should be considering it, because what I like about this is that it takes and looks at over 50 genetic SNPs of the individual, which are looking at, right, how is this nutrient transported? How is it absorbed? How does it functionally work in the cell? And then paired right next to that nutrient with those SNPs, you're going to find out their intracellular and extracellular scores. So this really is what it's all about. Every one of us wants to be able to help our clients. And it is not this one-to-many, it is 1 to the n equals 1, giving specific recommendations to the individual that's sitting right in front of you. And these are the types of tests that can be really beneficial. So we went over the hallmarks of aging, right? And we talked, I love that Dr. Hyman had this in his presentation earlier, the hallmarks of health, right? This is where our focus really needs to be. How can we help this person get healthy? It's great to understand the mechanisms, it's important, the pathogenesis of aging and all of the things that can occur. But what about, as Dr. Tom O'Brien was talking about, the integrity of the barriers, recycling and turning over of nutrients, the rhythmic oscillations that occur throughout the day, the circadian rhythms of hormones, our sleep hormones, that homeostatic resilience, leaning in and leaning out of the hormetic effect, right? Whether it's ice bath or sauna or depriving yourself of oxygen or exercising with exposure to carbon dioxide. How can we stress the body enough to make changes at a biochemical level, at a biological level, to see these changes then reflect on the biological age? And so it's really important for you to have a model or a framework. And I think Dr. Gladden presented his, which is phenomenal. Mine is not as complicated as his. His is amazing, and I'll tell you that if you haven't read the book, the 100 is the new, or 30 is the new 100, no, 100 is the new 30, I would highly recommend it. But the holistic longevity model that when I'm thinking through cases, I'm thinking initially around, okay, what do I restore? What do I need to resolve? How do I resolve inflammation? What nutrients do I need to restore? What do I remove? Detoxification, infection, dysbiosis. What do we need to reestablish? Even senescent cells in the remove phase. What do we need to reestablish? Do we need to reestablish the energy pathways in the mitochondria? Do we need to be considering to lean on that NAD a little bit more? Are there IVs that we need to be considering to add back in some of the nutrients? And then rejuvenate and regenerate. And this gets into some more of the fun stuff, right? The peptides, we can really start getting into the fringe in this area. Peptides, V-cell stem cells by Dr. Todd O. PRP therapy potentially, right? Hormones, do we lean on with peptides? Do we go with growth hormone? How do we do bioidentical hormone replacement therapy in individuals so that they can maintain a youthful level of hormones as their chronological age goes up? So to close out this talk, I want you to be thinking about some of the age reversal interventions in the holistic longevity method, right? And so resolving inflammation. If you don't know about AMPK and mTOR, Dr. Gladden spoke a little bit about this the other day. Learn more about that area, the AMPK activation, mTOR reduction, whether that's utilizing rapamycin to lower mTOR, or whether it's doing it through other natural strategies with fasting and decreasing carbohydrate load and lowering the protein levels. Energy, NAD+, restoring methylation, looking at homocysteine, looking at methylmalonic acid, looking at the genetic panel of your client and seeing if they have elevated SNPs in the MTHFR genes. Remove senescent cells with the Senolytics. Activate autophagy, which is very similar to the remove the senescent cells, and then lengthen telomeres. So I hope that you're able to take something away from this talk. I realize that it was a last minute get up and present. If you have any questions and you want to talk afterwards, I'll be around through tomorrow. But more importantly, I think that when we close out a conference, one like this, you need to be continuing the conversation beyond this room, beyond these doors. Be in a community of like-minded people that are learning this information. Consider getting a mentor in the area so that they can help you think through cases in clinical studies. I've met a lot of you through the hallways at dinner last night, from naturopaths to medical doctors to chiropractors to functional diagnostic nutritionists. We're all in this together. And I hope that when we leave this room, we can continue the conversation, continue to benefit our patients, our clients, get this information out into the hands of more people, to the ears of more people through social media, and really make a great impact on the world. Much love. Thank you so much. Appreciate you.